So they give herbal medicines to the patient depending on whatever the disease that they suffer. Would you like to come and give some Ayurvedic this thing? Like tulsi, haldi, I just mentioned those. Amla, tulsi, haldi.
Triphala.
These are triphala.
Triphala is the best.
Triphala is good, yes. Triphala is good. So a lot of these herbal, and it depends on what is, yes. Yes, they do have a dose. It's a whole therapy. Ayurvedic doctors have their own, dosages. There is Arjun they give for the heart. They have Sarpagandha for the blood pressure. They have a lot of medicines which they use, so they know best. Aloe vera is a nutritional supplement that also comes under Kumari Asav. I think it comes under Ayurveda. So they give that, right? So every center we have Ayurvedic doctors and homeopathic doctors. So wherever we feel that it does not get controlled only with Ayurveda and nutrition, we also introduce homeopathy.
So how can you take both the pathies together?
No. If it's not getting controlled, I'm saying.
So either of it. Alternate.
Yeah.
Cocktail of all pathies.
Cocktail of all pathies is called integrated medicine. Integrative medicine means using the best of all. Like allopathy is the most powerful, right? So that is being used by the patient anyways. But in spite of using allopathy, let us say he's taking statins or he's taking some medicines to reduce his hypertension, and it's not coming under control. It is still a little high. So then, along with nutrition, which is very powerful as an anti-aging tool and disease controlling tool, we use a bit of Ayurveda to detoxify. I spoke about detoxification. So you need to detoxify the body, which Ayurveda is 6,000 years old. So they have certain herbs which are very, very beneficial for improving digestion, ampachan, immunity, energy, controlling all these disease conditions. So they use all of this, and frankly, it is a mixture of nutrition and Ayurveda. If you want me to really concise it and tell you just two things, it's nutrition and Ayurveda. Exercise we give our patients anyways. Anyone is supposed to give exercise.
What about meditation?
Meditation, yes, for stress control, absolutely. You're absolutely right.
Actually speaking, ahar, vihar and vichar.
Very well said.
It's an old thing, old wine in the new bottle.
Yes, absolutely. Old wine in a new bottle.
Low
Absolutely.
glycemic index foods.
Yes.
Can you briefly mention something Ayurvedic in the
Ayurveda, the 5 things in Panchakarma. I am not an Ayurvedic doctor, so I'm going to call them. You want to talk about Panchakarma? One of you, come Shraddha, you want to talk?
Can you tell us something about low glycemic index?
Yes, I will talk about low glycemic index. Do you want me to answer the Panchakarma question first? Yeah? Come. Dr. Shraddha, would you like to address Panchakarma? So she'll guide you on what is Panchakarma, and then I'll talk about glycemic index. Come.
Yeah. So Panchakarma basically comprises of Vaman Vireshyan, Nasya, Shiro Vireshyan, Shirodhara and Basti.
You can translate.
Yeah, I'll explain you. So Madhav. So Panchakarma in Ayurveda is a universal set, I would say. So the extract or the essence of Panchakarma is what we do here at Health Total. Because in day-to-day life we won't be able to follow that kind of the lifestyle what is being advised in the usual Ayurvedic Panchakarma. So it's the essence what we do here.
No, but how you can say? Let us know.
So Panchakarma is all about cleansing, basically.
What they want to know is how the herbs detoxify.
Yeah. So we have got systemic cleansers. Okay, for example, kidney cleansers, then liver cleansers, colon cleansers, and also certain blood purifiers. So basically they are going to cleanse the same way as we. So Panchakarma is all about Shodhan, the same thing we do here, Shodhan and Shaman as well.
Minimum how many days will minimum dose or day?
Yeah. So minimum to undergo a complete detoxification, you require 60 days, around 60 days. Yeah.
So I'll just add. Yes. So when you do panchakarma, which is a more tedious process, you need 6 to 7 days according to the Ayurvedic doctors. But because you're taking herbal tablets like medicines to do the same job, and you're not going and doing that basti and virechan and all of that, it takes you about 60 to 90 days.
But then meantime we have to stop the allopathic treatment?
No, not at all.
Then how will you know
What do you
whether
mean by
it required or not required during the same
No. The allopathic treatment is given by the allopathic doctor. We do not interfere with his treatment. We do not interfere with the allopathic doctor's treatment. However, what happens is, when the patient is, let's say, taking an antihypertensive drug and his blood pressure is 150 by 100 after taking the drug for 6 months, the patient comes to us within 2 weeks of the program and the drug, his blood pressure falls to 120/80. Then it falls to 110/70. That's the time he goes back to his physician and says that, do you think I need to reduce my medication? The physician applies his own judgment and we fully go by that, because we do not tamper with the physician's treatment. If the physician feels that yes, on 3 consecutive visits, the patient is going under hypotension now, after all this weight loss and cleansing and all the processes, he reduces the drug dosage to half. Then he reduces it further. So in most of the case studies, the medicines have become zero after the program has stopped, or some have continued 1/4 dose, or the medicine has been changed. But we do not tamper with the allopathy at all. This is a supportive treatment. It's not a treatment alone. However, if a patient comes to us without having gone to any other doctor, let us say he's not with an allopathic doctor, and he's got high blood pressure and the same stuff, then we do our own therapies and it still comes down. In either case, his disease is managed. That is the point. Talking about, sorry. Yeah.
Can you
Okay.
please give some examples of a low GI breakfast?
Yes. So coming to glycemic index, it is the key to reduction of hyperinsulinism. It is very important to give a low glycemic index diet if you want to manage the insulin levels, the fasting insulin and the postprandial insulin levels of your patient, because that is the reason he's hypertensive. Most lifestyle diseases rotate around that, amongst other things, stress and a lot of other things we see. So the low glycemic index foods that we would recommend are anything with a lot of fiber, like oats, like millet, like jawar, bajri, nachi, whole grains, right? You can use low GI fruits like apple, pear, oranges, musambi, okay, cherries, peaches, plums, all these are low GI. Whole wheat bread and egg white. Now when you combine a high fiber grain with a protein, you are reducing the glycemic index of the meal. If you're taking the bread alone, the glycemic index is high. When you're combining it with the protein, so toast and egg white, fantastic breakfast. You add tomato slices, full of antioxidants, lycopene. You get a lot of lycopene. So toast, egg whites, tomato slices. Great, the patient is happy. Now patient will say, I want 4 slices bread. Therein lies the trick. Right? So the GI goes up and the GL also goes up. Right? The glycemic load also goes up. So you say, you can have 6 egg whites, which is perfectly alright, but do not have more bread, because that will increase the glycemic index. Yes.
The fiber of, like for example, a roti
Yes.
with the ghee, that is a fat, is it advisable?
Because see, you have to see all angles. Now when you add ghee, you're also adding calories to a person who's already 137 kgs.
Diabetic patients, I must say.
You're only talking about, depends, no? It's a personalized approach to, now your patient is thin or overweight? Medium. When you say medium,
Overweight.
so he is overweight. Alright. Do you wish that your patient loses weight, or do you wish that your patient stays the same weight for your treatment? To lose the weight. Then how can you add ghee? Think, yeah. Then you cannot. All ghees all oils, even olive oil. Every oil is 9 calories per gram. We are going, first let's worry about that. Then we go into saturated, monounsaturated, the coconut oil. Even coconut oil is 9 calories per gram.
Yes.
So we are trying to make him lose weight. Mufa is the best oil when you're talking about weight loss. But when I've done nutrigenomics, my eyes have opened, where some people gain weight with even Mufa. So to those patients who gain weight with Mufa, we only recommend Mufa-based oils. But that is going into real detail. That is called advanced nutritional therapy. That is what we practice, if you want to know. Because when we do the genetic testing, then like a lot of patients have the DRD2 and the DRD4 gene mutated, which means they have low levels of dopamine. When they have low levels of dopamine, they go into novelty-seeking behavior. So they feel happy when they eat too much or they gamble too much. This is novelty seeking behavior. Any pleasurable activity, or they exercise too much, or they overexercise. You have these exercise buffs who just go, why? They get a high. When they exercise, they get a high. When they eat, some people are compulsive eaters. So that we do with the gene test, you know that the DRD2 and the DRD4 is mutated. So this person does not have a choice. She will be novelty seeking. So we tell them, okay, get connected to any other activity. Let us say you want to watch movies. You rather watch movies than sit with a plate of chips and eat, right? So we counsel them. It's a personalized counseling session. But just to answer your questions, toast and egg whites reduces the glycemic index of the meal. Lunch and dinner roti sabzi is a great option. Wheat today, people have the celiac problems. Inflammation increases with wheat usage. So you cannot use too much wheat.